So once again, just to review, this is the beginning of ANAT1, and I'm Evan Lee. Feel free to contact me at this email, Canvas, or talk to me before, after, or during class. So let's keep on going. So to talk about this class is a pretty simple format in that you don't really need much except for access to Canvas. So basically, everything that you'll need is going to be found on Canvas. That's where you're going to find the syllabus, the schedule, the lecture notes, the lab materials, the lab manual, the assignments, and then any supplementary materials such as various study guides, like study guides for the lecture, which I call PAL questions or proactive learning questions, and then practicum images, as well as like lab videos, which will be really useful for you to be able to review the lab material as much as you need to. So I have a lot of tools that are going to be found on Canvas. I organize them very specifically. So let me go ahead and just show you that now. So, alrighty, so to start off with, we have our home page. You can see that this is our Canvas for ANAT1, Human Anatomy, and you can see on the home page various things that are going to be important to you. I mean, if you need to contact me, you can do that through my email, or remember, you can use the Canvas messages. So go to inbox and you can message me there. You can find the syllabus here, our meeting times, our meeting place, and then our office hour link. But then the place that is really important to you, if you want to click here, you can go ahead and do so. Like this is going to bring you to it, or you can click on modules, which generally goes to the same place. So what you probably have seen here is that there is only 1 week's worth of posts so far, but this is where I'm going to be posting a page which will have everything that you need for that week. So notice this says week 1, Introduction to Anatomy and Cell. And if I click on this, this brings you to where you're going to find everything you want to see. So I have the narrated PowerPoints. Go ahead and download these. I have the structure list for the labs. Go ahead and download these. And then I have some supplemental stuff that you can use as well. So these are lab videos. Like I made videos that are going to go along with lab. Please feel free to use it as much as necessary. And to give you an example, if I click on this and make a new tab.
Hello everyone, welcome to the Anatomy Lab. Today we're going to be taking a look at the cell and all of its internal...
Basically, this is a video that's going to go over structures on models or bones that we're going to be using in the lab. So,
circular structure.
If you need something to guide you through the structures, if you need help with finding something, or if you need some maybe helpful hints or tips, like these videos are going to be able to do that for you. So I have links here, but I also embedded them in the bottom. So if you need to find them more easily, sometimes seeing these is a little bit more easy. So I'll have the videos down here for each week as well. But then furthermore, 2 more things that once again can be very helpful to you: practicum study materials, and then PAL questions are basically the study guide. So if you click on these, once again, they'll bring you to, well, 2 things, but I don't know if it's gonna download while I'm on Zoom very well. Oh, here we go. Not too bad. So if you look closely, these are practicum study images, which I will be adding more to, because I think there were some requests for more images, but if you look closely, these are just more images supplemental to the PowerPoints or supplemental to the lectures, which just has more images and more examples and more perspectives so that you can find these in different ways. But then if you also notice, you can see that there are some words at the upper left corner of each of these slides. And it's not that many words at first, but if we go down to the cell, which you can see here, like this basically has a list of stuff that you want to be able to find. So these are the structures that you should try to find on this image. And if you can do that, then you are in really good shape. Like this is a method that you can practice identifying these things so that you can be prepared for both the quizzes and the lab exams, which we'll talk about in just a moment. So this is the way that I am giving you additional tools to be able to study and identify stuff and to give you more images that you can work with as well. So these are the practicum study materials, but then also the study guide, or for the lecture exam, this is what I call the PAL questions. So the PAL questions, you can see, like, it's not going to be super extensive. I don't want this to be like 20 pages or anything, but some of these questions are basically just helping to make sure that as you go through the lectures, like, it's making sure that you are getting the gist of it, basically. Are you understanding what you are supposed to be getting from these lectures? And once again, if you can answer these questions, then this should be very helpful for doing well on the lecture exams. So, but some of them can be quite extensive because I know it just is one line, but it says no general functions and examples of organs of all 11 organ systems. So this answer can be quite long. So make sure that you do it fully, and that should really help with making sure that you succeed in this class. So far, I'm just trying to show you all of the tools, and I think I'll go over it slightly again on Wednesday just to kind of reiterate some things that I want to make sure is clear. But just to ask, does anyone have any questions about anything so far? I mean, if you do, please go ahead and write it in the chat, or you could speak up if you'd like, but I will be monitoring the chat just so that I can kind of see how everyone's doing as well. But with that said, then, let's go ahead and go back to our PowerPoint, which is introducing the course. So we've been talking about Canvas, we've been talking about where to find everything. So just to be really simple, lecture PowerPoints are going to be basically everything you need for lecture notes. And then structure lists is where you're going to find everything that you need for lab materials. Now, I've been talking a lot about the course, but I haven't even really talked about what anatomy actually is. So just to explain, anatomy is basically like the study of structures of the body, as in the structure in its shape, its orientation, its location, its relative position to other things. That's what we're going to be looking at when we look at anatomy. So hold on one sec. Found. Oh, okay. Is anyone else having issues with opening up the lecture notes? Or, okay, let me check that, because that's not good. So I'd like you to have the lecture notes, but I don't know why it wouldn't be. So let me just double check that. Hopefully I can fix this quickly, but I don't want to have you sit there too long. Everything seems like it should be accessible. Yeah, let me just try relinking it then, and hopefully that will help. Sometimes there are issues that just come up with those kinds of things. Hopefully not too much though. Is it just the lecture point PowerPoints, or is anything else also having any issues with not being able to access it? But as far as I can tell, I think this should help with fixing it. So try it one more time, and if it doesn't work, I'll have to look at it a little later. Okay, good. So if it I mean, hopefully that fixed it. If it's just the PowerPoints, that should have fixed it. But I guess let me go ahead and just continue on. Just try to listen while we're going over it. But let's talk about anatomy a little more. So just to be clear, we're talking about structures of the body, names, locations, shapes, orientations, all that stuff. That's going to be what's included in anatomy. But just to be clear, there's different levels of anatomy that we're going to be looking at as well, which can include microscopic anatomy, as in really small things in the body, as in things that you need a microscope for, various tissues of the body, like major types of things that do functions, but then complex parts of the body called organs. And then just to tie everything together to some extent, we are going to be talking about a little bit of physiology. So physiology basically just means how does it work? So we're definitely going to talk about what is everything, where to find it, but knowing a little bit about why it's there and how it works is really helpful for putting everything together. Now, just to be clear, anatomy can be a bit tough. And I know this is one of the first science classes that you have in your requirements. But just to be clear, this is mostly going to be for people that are hoping to go into the health field, as in like if you are pre-nursing, if you are pre-PT, pre-med, or something of the like this is the course that you are going to be required to take. So if that is the case, please check to make sure that this is the course that you need, because this is actually a course that I think is really helpful, and it's really interesting and really good at broadening your scope of like how you understand humans. But to be honest, this class is more work than what you would want for just like a general ed. As in like, if you're taking this just to fulfill a science requirement, then I would probably take something else. But if you are here for pre-nursing, pre-PT, or otherwise, you're in the right place. And I mean, I know I said it's tough, but you can do this. You can definitely do this. So we're going to work through this, and we're going to make sure that you succeed in this class. But it's going to take some work. So I'm going to just put that out there right now. And good. I'm glad I got fixed. Oh man, those first week things always creep up on you. But yeah, this class can be tough. So just make sure that you know what you're getting into. But with that said, let's talk about like the course a little more. So just to be clear, I said this is hybrid lectures just because I'm adding the audio with the lectures. But to be clear, attendance is required in class, and the class is going to be in person. So please make sure that you are aware of that. Like this class is going to have twice a week meetings, Monday and Wednesday from 4 to 7, which will both have a lecture and a lab each day. But just to be clear, everything that you need for the course, remember, is going to be found on Canvas. So whether you're trying to find the lecture PowerPoints, the lab videos, the assignments, all of that stuff is going to be on Canvas. Now, some other stuff that will be a part of the course, but this will come a little later. So first of all, we do actually have a book that you can get, but it is optional. And if you can find a lower priced version of it somewhere, I would probably recommend that because the pictures don't change too much. But if you want a tool that will have like various types of pictures that will cover a lot of the structures that we have here, like as a tool to supplement the PowerPoints, this is the book that I would recommend. So the McKinley book, Human Anatomy, any edition generally. So if you can find that book, it has a lot of good images. But once again, the lecture, the exams are going to be based off of the PowerPoints. But furthermore, we will have a dissection. I believe it will be a MINC, and that is going to be required for this course. Like that, a dissection is a requirement to fulfill the role in your health field requirements. So we will be having a dissection, which will require some dissection tools. But we do have quite a few tools in class, but if you want your own tools, you definitely can get it. But one thing that I would get though is gloves. Like gloves will be necessary. I will bring some gloves, but if you have like really big hands or really small hands, like I'm bringing medium because that's what most people will fit. So if you need gloves and you want your own just to make sure that you have them, that would be something that I would recommend. But then lastly, for stuff that you'll need. So since everything is through Canvas and everything is on digital formats, you'll just need some sort of electronic device to access them. So whether it's a whether it's a laptop, a tablet, or even your phone, although the phone can be a little bit more difficult, that's basically what you need to access the materials. So as long as it can open up PDFs, as long as it can open up Word documents and PowerPoints, then you are basically good to go. Like you have everything that you'll generally need in order for you to access anything for the course. Now to talk about your grades and how that's going to be broken down, you can see that we have quite a few different types of things, but the main things for sure are the lecture exams and the lab practicums, which are basically the lab exams. So you'll have 4 90-point exams. That'll give you 360 points, and 5 45-point practicums, which give you 225 points. So these two are definitely the biggest overall grades in your course. So out of 840, 360, that's probably around 40 something percent. So, oh yeah, Christina. Or if you want to.
Sorry, if I know that I'm gonna I'll miss a day when there's a practicum. Are there makeups allowed for that?
I will have to talk to you about that a little bit more specifically because it definitely depends on the reason. It depends on whether we can fit that in or if we have like a time to do so. So I do allow for some amount of makeup, although typically that is due to if there's a very serious or out of your control type of situation. So I think that might be good to talk about privately just so that, I'm not asking you too much or you to share too much, but
okay, thank you.
We can talk about that maybe on Wednesday.
Thank you.
No problem. So once again, if you do have a makeup, it does typically require some sort of situation that you have no control over. And furthermore, some sort of documentation is definitely helpful to further your case in that case. But once again, to get back to your grades, lab exams and lecture exams, those are the big parts of your grade. But we also do have some more kind of regular things that will be throughout the semester, not to necessarily like the big ones, but you'll have weekly lab quizzes. You'll have almost weekly class assignments. And then throughout the semester, you'll also have these lab assignments, which will be in lab, as in like when you're in lab, you turn it in that day or rather that night, and you'll be able to get your points there relatively readily. So once again, being in class is necessary. And in order for you turn this in, you also have to be in class for that. So lab assignments, and then a couple of kind of like big ones as well, I guess. The mink dissection, that's a project that you'll be doing midway in the semester, and then also just attendance. So this is what's going to give you your overall grade though. So yeah, we'll have a lot more to talk about when we get closer to the exams and practicums, but I will be talking about them, well, right now. So let's go ahead and take a look at the schedule before we do that though. So you can see how we have our lecture, our lab, and then generally any type of assessment for the lab as well. So lecture, you can see you have all of the different topics we're going to cover. Today is just introduction and overview, but then on Wednesday, we'll talk about the cell and then a little bit of tissues. But you can see those topics go down the list, and this is a tentative schedule, so it might be changed just a little bit, but generally, I don't think I'm really going to change the exam dates without a good reason. So if you look closely, I would definitely try to take note of those exam dates so that you know when they're coming up and when to prepare for them. But furthermore, looking at the lab, you have the lab topics that we're covering. So make sure that you are aware of what we're covering, but furthermore, make sure that you're aware of our practicum days. So you can see that the practicums are going to be throughout the semester as well. You kind of have 5 of them, and these once again are kind of like the big lab assessments. So what I did here is I tried to make sure that there was never a practicum and exam on the same day. I tried to spread them out as best I could, but unfortunately, that also kind of means that you have like practicums and exams kind of almost pretty consistently. There's only a few weeks where we don't have one or the other, but just to be clear, whenever we're going over stuff in the lecture, we typically go over it in the lab as well. So the material should be pretty consistent between the two, but it is quite a few exams to go over. But what that also means is we don't have any like really big, heavy exams. Like that's one of the things that we also try to prevent. So, I mean, we don't want too much on any given exam, but we also don't want exams on the same days. So there's a question regarding exams or like exam, I guess, format. And yes, exams are going to be in person. So any given day, we'll take the exam like generally at the beginning of any class. And then depending on what we're doing that day, we will have a lab or a review for the time afterwards. But yes, exams are definitely in person, especially practicums, because practicums are going to be like in your hands, as in like you will have bones in your hands, you will have models in your hands. It won't be on, well, some pictures, but mostly it'll be using the things that you see in class. So just be aware of like the big days though, for sure. The exams and the practicums, but generally you have at least something most of the weeks. So hopefully this kind of format isn't gonna make anything too heavy, but you do have a few exams out there. So I guess to talk about them, lecture exams. Oh shoot. So lecture exams actually got modified to being 90 points. So 90 points for a lecture exam. And most of it is going to be multiple choice. And in fact, some of the exams will be completely multiple choice. But there could be some short answer questions in there as well. So in that case, paper will be provided, and that is going to be how you can answer the questions there. So just to be clear, the lecture exams, though, those are based off of the lecture PowerPoints. So lecture PowerPoints, that has everything that you'll need to answer the questions from the lecture exam. But then furthermore, lecture assignments. I mean, lecture assignments are from the PowerPoints as well, but if stuff is asked in the lecture assignments, that would be a good thing to maybe focus on so that you know it for the exam as well, at least potentially. Oops. Now for the practicums, once again, this was modified a little bit, but this is 45 points each. And that is going to give you, once again, a pretty big chunk of your grade. But this kind of exam is a little different from probably what you're used to. So practicums, just to be clear, are basically hands-on exams. I'm not going to be asking you to do any type of procedure. I'm not going to be asking you to like speak or, verbalize an explanation or anything, but you will need to be able to identify stuff and then write their names to answer questions. So in this case, like this is not going to be multiple choice. You'll need to know the structures and you're going to have to kind of show that you can identify them. So that's really what anatomy comes down to at its basic form. Can you identify these structures? Like, do you know what this is, basically? So that is going to be generally what the lab practicums are like. But we will have some practice stuff before we get there, which will be which will be associated with the lab assignments that we'll have as well. So just remember, for anything in lab though, the practicums or the quizzes, it is based off of the structure list. If you ever want to know what you need to know for like a lab assessment, always look to the structure lists. Now quizzes are kind of like mini practicums, except it's going to be on PowerPoint format. So, I mean, we don't need to set up all these models for quizzes, but quizzes will be a good way to know how you're doing along the way. So the quizzes are going to be generally weekly, as long as we don't have a practicum that week. So this is going to be how you can kind of keep track of whether you are keeping up with the material. So if you feel like you are not doing well enough on these quizzes, then we would like to adjust how we're studying so that we can do well on the practicums. So, but once again, though, since it is a lab quiz, it is based off of the structure list. Now, to give you a couple of examples, you can see what these questions are like for the quizzes. Like these are things that you could be asked, whether it's identify the structure in the brain. So this structure is what you'd identify. This is called the corpus callosum. And then this structure points at this muscle, like in the face. This is called the mylohyoid. So you can see that you have these pictures. You have a short prompt, which is typically identify the structure or identify the layer or something of the like. And then you have to look at the very tip of the arrow to identify the structure in the question. So this is what the lab is going to be like, making sure that you can identify these structures, but you have various exercises in lab to help with making sure that we practice that as well. Now, lastly, just in general, I mean, this is a course in college and honesty and academic honesty is expected. So just make sure that you be honest with yourself. Don't cheat. Just do your own work. Don't look at anyone else's papers. And I mean, this is going to be like, or this is a major class that you take before you go into the health field. Like, this is something that you want to be able to have the fundamentals in. This is stuff that you want to be able to understand before you go into any of that thing. So, I mean, it doesn't necessarily get easier. You definitely want to make sure that you can keep up with this type of course material. So this is a good time to kind of adjust how we study, or maybe even work on the different tools or the different methods in which we do so. So with that said, I think that's it for like the intro to the course. Does anyone have any questions about anything? Otherwise, we're going to start our lecture, which is going to be introducing anatomy. All right, sounds good. Let's go ahead and take a look at our first lecture, which is regarding anatomy. So, where's my mouse? Alrighty, so let's go ahead and get started. Alrighty, well, let's talk about anatomy. So just to once again reiterate, anatomy is the study of structures and organization in the body. So anatomy is identifying structures, identifying parts, as well as knowing how everything is connected, oriented, and related to other structures. But just to be clear, anatomy typically does also go hand in hand with another topic called physiology. So anatomy and physiology are two words that usually go like hand in hand because structure typically is very important to function. So a certain structure or organization is going to also definitely play a role into how it works. So typically when you think about anatomy, it's good to also kind of to consider, what does it do? As in, like, why is it there? Why is it there? Why is it that shape, that length, and what are all those little things on it? So that's what we're going to be looking at in anatomy, mostly the structures, but we will also try to consider a little bit of function and physiology, just so that we can help with putting everything together as well. Now, just to be clear though, like, anatomy is actually a pretty broad range of topics. Like, it's not just anatomy. There are different parts of anatomy that go along with it. So just to give you two to start off with, we have gross anatomy and microscopic anatomy. So gross anatomy, like, gross doesn't mean like ew, gross means basically the overall structure. And in this case, when we say gross anatomy, you could basically think of it as the anatomy that is visible to the naked eye. It's like stuff that you can see on anyone very normally. So, I mean, basically, you can see my face right now. That would be some amount of gross anatomy, not like, once again, ew, but you can see my eyes, you can see my nose, my mouth, my lips, my tongue, my cheeks. So those are all aspects of gross anatomy. But what you can't see is the microscopic anatomy. So if I were to take like a very, very thin slice from my skin, and then I were to put it on a microscope slide and then obviously use a microscope, I would be able to see something very, very different. I would be able to see these small cells or layers of cells and tissues, which would not be visible to just looking with my eyes. So believe it or not, we are just completely made up of like groups and trillions of cells. So we're going to be talking a little bit about that at the very least, but there's definitely a big difference between gross and microscopic anatomy. Now, a couple of other fields of anatomy, developmental, and then a part of that, which is embryology. So developmental anatomy is where you have basically anatomy as it changes throughout life. Like, you can see the differences between this brain at 5 months, 7 months, and 9 months. And as you can see, it's starting to get bigger and more complex as it gets older and more developed. So developmental anatomy, like, you definitely change quite a lot from going to zygote to fetus to baby to toddler to child to adolescent to teenager, adult, and elderly. So, I mean, believe it or not, you are still going to have a development throughout your life, and your body is going to change. Your bones are going to change, your skin is going to change, and those are things that you study in developmental anatomy. But one specific range of developmental anatomy is embryology. So embryology, referring to embryos, that's going to be stuff that is during the maturation before you're born. So basically, embryos are what you can consider the baby while within the womb. So as it's developing, that's where you get a lot of drastic development, and that's where we study it specifically in embryology. Now, once again, a couple more like fields of anatomy, like one that you probably have used, or the one that you're most familiar with, surface anatomy. So when you say the word surface anatomy, that just means the stuff on the outside. So anything that you can basically see from the external view of the body. So there are definitely things that we don't consider, though, when we look at the surface of the body, such as maybe what muscles stick out, what bones are there. But obviously, you probably think of like your arm, your shoulder, your leg, and so on. But to kind of like continue looking at this, you have like the sternum, the clavicles, the sternocleidomastoid, the thyroid cartilage. So there's definitely a lot of stuff that you can see from the surface of the body as well. Now, to get started with talking about like some specific stuff, we have to kind of introduce a few things regarding anatomy. So the first thing that we're going to talk about actually is the organization of anatomy, as in like a hierarchy of organization. So when I say the word hierarchy, that just basically means that it goes in order, and specifically in order from small to large. So we're going to start out at our smallest level, and we're going to then kind of combine them to get bigger and bigger and bigger and bigger. So looking at what we have first, we have the atom. So the atom is like small little particles, which some examples of which could be like carbon, oxygen, nitrogen, iron, or so on. So atoms are going to be really, really, really tiny. But then what you get when you combine atoms is called molecules. So atoms on their own, those are like elements. Those are like the natural elements of the world, the ones I was just talking about. But when you start to combine those, that's when you get more complex things. This is where you get stuff that will have different types of properties, which will be very, very important to the body. So we have molecules, which are basically combinations of atoms. So what do you think we're going to do next? We're going to combine combine molecules. But this is a pretty big step. Like when we start to combine molecules, we're going to organize them very specifically to form cells. Now, this is an important step or important stage of the organization because cells are the basic unit of life. Like, generally, nothing living is less complex or smaller than a cell. So, these cells, like these are going to be very specific organizations of molecules, but basically, when you put those molecules together, the next level that we get is a cell. And once again, those cells are like there's many different types of cells, including muscle cells, skin cells, bone cells, nerve cells. So whatever this type of cell is, like it's definitely going to do something, but one cell on its own can't do that much. So what do? Like we combine the atoms, we combine the molecules, and now we're going to combine the cells. When you group up a bunch of cells, like one muscle cell is great, but more than one muscle cell is even better. So with more than one muscle cell, it can definitely do a lot more than on its own. And then in this case, now you have a tissue. So you go from cell to tissue, and then let's just keep going. After tissues, you'll have organs. Combine those organs, and you get organ system. Combine those organ systems, And finally, you've got you. So I know I spent quite a bit of time on this, but we're actually going to go through this one by one as well. So let's go ahead and do that. So let's take a look at what we have here. Starting at the smallest, we have the atoms. So the atoms, once again, the carbon, the oxygen, the hydrogen, the nitrogen, like those are the very basic elements in the world. But combining those together, that's where you get the molecules. So in this case, you have combined 1 carbon and 4 hydrogens. This is a little bit more complex, but specifically the molecules that we are mostly interested in are the basic units of human life. And that's going to be proteins, lipids or fats, and then other macromolecules such as sugars and otherwise. So atoms, smallest, combine those atoms, molecules, combine those molecules, and you get the cell. And once again, this is a big step, but if you do organize those molecules into a cell, this is where we start to talk about like living things. And although these cells are small, they still do like a function because like it's a living organism at this point. So in this case, this is a smooth muscle cell, which generally its job is to get long and short, long and short. Like that's what a muscle cell is going to do. But this muscle cell isn't doing much. It's not like, lifting weights for you or anything. You have to combine these cells together now. Like if you combine those cells, like one cell can do only so much, but more than one cell, and it'll be able to do a lot more. So when you when you combine those cells together or group those cells together, this is where we get a tissue. So the tissue, you can see like one muscle cell, okay, that's great, but now you've got a bunch of muscle cells, and now it's actually going to be able to probably do something. Like one cell isn't going to do a whole lot, but multiple cells, this is where you start to get some actual bodily activity. But once again, I mean, a tissue is great. It's going to be able to do something for you. Like this muscle contraction is going to be a bit stronger, but what are you going to use that muscle for? Like, why do you have this muscle? And one place that you might find smooth muscle is if you combine different types of tissues together now, you'll find it in a blood vessel. So this is what we consider now an organ. So tissues, just to be clear, typically have like one main function. It just has a bunch of cells grouped together. But if you have multiple different types of tissues, this is where things get a lot more complex. This is where things get a lot more complicated. But also, it allows you to do a lot more specific function in the body. So look closely and you can see some of these smooth muscle cells in here. Those smooth muscle cells are in a blood vessel. And have you ever heard of the words like vasodilate or vasoconstrict? That's what's happening when you have those blood vessels or those muscles in your blood vessel. They can either allow the blood vessel to get bigger or smaller. But along with those muscle cells, now you have connective tissue to protect it. You have epithelial tissue to line it. You have nervous tissue to stimulate it. Like you have all of these things to help with forming the organ now. But once again, what's a blood vessel going to do on its own? So when you have multiple blood vessels, when you include like maybe even the heart in that case, now you have an organ system. But the organ system is where you have like a very important level of organization in the body. Like generally, if you are missing one of your organ systems, oh, you are in trouble. So organ systems, like, okay, you can do with maybe you can be missing a muscle, you can be missing an organ to some extent. But if you're missing an organ system, then that's where big issues start to happen. So organ systems are very complex and very vital to human life. But this is But this is just like the building of the organ system, because you've got many different types of organ systems. With all of those organ systems together, that's where you have the human. So if you look closely, organ systems can include the lungs, the respiratory system, the cardiovascular system, the digestive system, the muscular system, the bone system, and so on. So after you combine all those organ systems, that's where you now have the organism. So let's go ahead and introduce these organ systems too. But just to be clear, I won't go over them too much, but remember, they are really important. As in, like, without these organ systems, you generally don't survive. But basically, these are the systems that we're going to be looking at one by one as we go throughout the semester. So, I mean, if you want to get a view of, or some perspective of the things we're going to be learning here, you can see it right here. So let's go ahead and talk about these a little bit. To start off with, the integumentary system. Now, when you say the word integumentary system, that sounds really foreign, sounds really tricky, but it's actually just your skin. Your skin is going to be one of your major organ systems. In fact, it's one of you, I think it's your biggest organ system of your body. Like, there's actually quite a lot of stuff that goes into your skin, and it's covering your entire body. So if you look closely, skin isn't just like a covering. It actually has a lot of stuff going on with it. It has blood vessels, it has muscles even, it has glands, it has hairs, it has organization. So the integumentary system is going to be quite important to the body. So hopefully I don't sound like too much of a broken record, but all of them are going to be important. Now, our second organ system that we have here is the skeletal system. So the skeletal system, this is your bones, and generally you have about 206 bones, but like bones, I mean, obviously bones are giving you structure. Bones are giving you support. Bones are giving you protection. But bones are actually going to do quite a bit for your body. So one thing that doesn't get brought up enough is that bones are actually critical to your bodily movement. So when you think about your bones, you think of them just being inside your body, but when you like bend your arm like this, what are you doing? Like, your muscles definitely are contracting, like they're very important in this, but they're actually pulling on your bones. Like, they're connected to your bones and they pull on your bones in different directions to give you a coordinated type of movement. But even like weirder about bones is that bones actually make your blood cells. So have you ever heard of bone marrow before? Like bone marrow, I mean, sometimes it's kind of fatty, but bone marrow, red bone marrow specifically, is where all of your blood cells come from. Red blood cells, white blood cells, platelets. Like, that's going to be helping you to make all of your blood cells. Now, kind of talked about this in the last one, but muscular system, this is helping to, well, coordinate movements of the body. It does act with the bones though, but as you can see, you've got muscles all on the outside of the body underneath your skin, and then even on the inside, like inside of your blood vessels, inside of your digestive system, because it's helping to move things throughout the body. But furthermore, like every time you do move, you're also producing heat, which is another really important thing about the body. So if you ever need to heat up, if you're cold right now sitting in your house, like you might be shivering or shaking your leg, or maybe you can do some jumping jacks and you'll be able to warm up pretty quickly. Well, maybe, but yeah, you like muscles, obviously they're definitely used for movement. They're coordinating the actions of the body, but heat production is also very important as well. Now, the nervous system, this is one that comes up quite, or that a lot of people know about as well, because it's going to include the brain and the spinal cord. But then, just to be clear, like, although those are the big things, I mean, basically going to everywhere in the body. Like, imagine touching your skin anywhere on your body. That's because, or you can feel that because of nerves. So the nervous system is allowing you to send signals throughout the body, but it's so cool because it could send electrical signals, as in, like, it can send signals very fast. So if you're trying to go from your fingertips all the way to your brain, I mean, it'll be like a fraction of a second. So it doesn't take long for you to feel like when you touch your skin that you know that you're touching your skin. Now, here's one of my favorites, very overlooked and very underappreciated, but the endocrine system. The endocrine system is one that doesn't get talked about too much, but you probably have heard of like glands in your body and then also hormones in your body as well. So some major glands include the thyroid gland, the pituitary gland, the adrenal gland, the pancreas. Like, all of those are various types of glands in your body, and they all make hormones that are going to affect you. So hormones don't get enough credit. Like, they definitely show up when something goes wrong. Like, I don't know, people definitely like to think of hormones when maybe they have low metabolism or when they can't control blood sugar, but hormones are controlling a lot of stuff and a lot of big functions too. I mean, metabolism is a big one. Blood sugar is also a pretty big one, but it's also going to control growth. It's going to control neural development. It's going to control sexual development. Like, endocrine systems or your endocrine systems are controlling huge processes that your body is undergoing. But I mean, I don't want to talk too much about it yet, but just know endocrine system uses glands and secretes hormones to do so. Now, our next system that we have here is called the cardiovascular system. The cardiovascular system, this one has some words in it that you probably are familiar with. And cardio, what does cardio mean? And then vascular, what does vascular mean? So cardio is usually one that's pretty self-explanatory, but when you say the word cardio, when you do cardio exercise, what are you trying to work out? Your heart. So whenever you can, like, especially for this class, like, because there's going to be quite a few things that we're learning, try to make any type of connection that you can. Because if you do cardio exercise, then you probably know what the word cardio means. And if you see the word cardio, whether it's in cardiovascular or cardiac cell or otherwise, then you'll at least be able to use that to learn it a little bit or remember it. So cardio, but then also vascular. Like, does anyone work out? Does anyone trying to go to the gym, get yoked, like really buff? Like, if you are, or if you know anyone that is, they may have used the word vascular, which basically just means blood vessels. Yeah, so combine those two. Cardio and vascular, that's heart and blood vessels. And this is how you pump blood throughout the body. And once again, crucial, because without your cardiovascular system, you can't get oxygen to your tissues. You can't pick up waste from your tissues. You can't send hormones because hormones require your blood as well. So, I mean, cardiovascular system, one of the ones that people actually think about because your heart is pumping all the time. So we'll talk about this once again, but let's keep on going to our next one called the lymphatic system. And now, once again, another overlooked one, just like the endocrine system, but this one you probably know of because this one is your immune response. This is what's controlling your immunity, as in, like, when you need to fight off a cold, go through your lymph nodes, filter stuff in your body. This is usually through the lymphatic system. So the lymphatic system actually has quite a few different functions, but its major one, like using lymph nodes, tonsils, and specific organs like the spleen and thymus, this is your immune system. This is going to help with protecting your body from foreign agents, basically. So lymphatic system, a little bit differently organized, but you can see these other tubes called, well, lymph vessels, which are not necessarily like blood vessels, but they definitely do help with transporting some fluids as well. Okay, just a few more, but our next one is called the respiratory system. Once again, the very well-known one, and some major organs that you probably have heard of, like the trachea, the lungs, or maybe the diaphragm. Like all of these are major parts of the respiratory system, but just to be clear, what we're trying to do here is just move air. We're trying to move air in and out of the body so that we can do something called gas exchange. So we want to be able to get oxygen, but also get rid of waste as well. Now, digestive system. Digestive system is going to be another important one that, I mean, I'm thinking about right now because I'm getting kind of hungry, but I mean, let's finish this first. But digestive system. This is how you take in food. This is how you break it down. But then generally the most important part of this whole thing is absorb nutrients. So to absorb nutrients, you have this, or like you have to go through the digestive system and then basically bring it into your blood. So if something just passes through this system, like if a hamburger just, you swallow a whole hamburger and it comes out the other end, you're not really getting anything from it. So it's really important to break it down and then absorb the nutrients so you can actually get something from your food. Now, not necessarily unknown, but one that people don't appreciate enough, the urinary system. I mean, we use it every day. We use it probably almost first thing every morning. The urinary system makes urine. But the reason it does that is because it's filtering your blood. It's taking the stuff out of your blood that you want to get rid of. Like, you don't want all of the uric acid or the urea, rather, and the ammonia. You don't want all of the excess fluids, but your urinary system is the part that's allowing you to do that, or like get rid of it, rather. So the major organs of your urinary system are called your kidneys, or rather these are your renal organs. So I know I'm using the word urinary, but what we're going to see is that renal is another good term to kind of consider regarding your kidneys and your urinary system. Because have you ever heard of the term renal failure? I mean, I hope you don't use that often, but renal means kidneys. So we're going to see that a lot of terms that you probably have heard of is going to be applied in our class. So renal, urinary, kidneys, we're going to be talking about that for sure. I mean, later on though. Now, lastly, we have the reproductive system, another well-known one, probably one of the ones that gets a lot, or one of some of the most attention. But the reproductive system, just to be clear, this is the system that is going to allow for making babies. So, reproductive system, that's going to include two versions of these organs, one for the male and one for the female bodies. Ovaries, uterus, vagina, that will be for the female reproductive system. And then testes, vas deferens, prostate, penis, that's going to be for the male reproductive system. But along with that, it comes with making the cells, the egg cells and the sperm cells, but also the hormones, estrogen, progesterone, and testosterone. So with that said, though, those are your 11 major organ systems. So I mean, look forward to seeing those throughout the semester, but we just wanted to introduce that before we get started. Now, still in Introductory to Anatomy, we have some terminology that we want to try to become familiar with as we're talking about them throughout the class, because this stuff is going to be used throughout the class, and furthermore, knowing these things and being familiar with them will be quite helpful as we start to describe stuff and learn about stuff in the body. So to get started, we have the term anatomical position or anatomic position. So whenever you try to locate something or describe the position of something in the body, you always want to think of it in anatomic or anatomical position. So look closely at this person and you can see a few specific things. Number one, they are standing upright. So this is up, this is down, but then furthermore, feet are together, facing forward, arms along the sides, but also the palms are facing forward. So what direction are the thumbs pointing? They're pointing outward to the sides. So whenever you describe the thumb, like you should be thinking of it in this position. So whenever we talk about anatomy, we're always going to talk about it in anatomical position, but also one last thing for this at least is always think about left and right in terms of the person. So not necessarily always your left and right, but the person's left or right. So in this case, this would actually be their right hand, their right forearm, right arm, and then this would be their left knee, left thigh, left leg, and so on. Now, what we're going to be using throughout the semester are things called, well, mostly directional terminology. So basically, these are just different types of terms that we use to describe the position of stuff in the body. But just to kind of give you some examples of how to use this, like something that we're going to do is describe the relative position compared to something else. So usually, like when you use these terms, you're going to say the blank is close to blank, or the blank is in this direction to blank. So just to kind of give you an example of why I'm even talking about this, like when you say a direction, like look, or let's just say Los Angeles is north. So great, Los Angeles is north. But what does that actually tell you? Like, is it walkable? I mean, is it 20 minutes? Is it half an hour? Is it 4 hours? Is it in Alaska? Who knows? Because we know it's north, but you want to have some sort of comparison to make it a little bit more helpful. So in that case, I could say Los Angeles is 30 minutes north. Because if you drive 30 minutes, generally you'll get to somewhere in Los Angeles, barring major traffic, but at the very least, it gives you a much better idea of where to look. So that's what we say, or that's what we are talking about when we say, like, you describe something and compare it to its location to something else. So let's go ahead and try this out and talk about some of these terms. So take a look here, and we can see that we have the words superior and inferior. And basically, these are just directions indicating something being above or below. So up or down. So superior and inferior, luckily, are terms that we kind of have used, throughout our life in some way. Superior usually means something is better or above it, and inferior means that something is below or worse. And it's the same thing here. Superior is above, inferior is below. But let's see how we use these terms. So if I said the eye is superior to the mouth, that means that the eye is generally above the mouth. So in that case, I'm describing where the eye is, and I'm comparing it to the mouth. Because you wouldn't say the eye is like superior to the belly button, although technically correct. It's more helpful to compare it to the mouth. So this is how we give some sort of relative position. And then opposite of that, if we want to describe the mouth compared to the eye, we would say the mouth is inferior to the eye. Now to talk about a couple more directions, we have anterior and posterior. Now these are a little bit less familiar. I mean, anterior for sure. Like, I don't know anyone that really uses the word anterior outside of anatomy, but basically that means the front or in front of. But posterior, if your parents have ever talked about your posterior, they're probably talking about your butt. Like, posterior is the back. So anterior and posterior, just like front and back, just like how we had superior and inferior being up and down. But then furthermore, we also have two more terms that we might see, which are ventral and dorsal. And once again, ventral is a little bit less known, but dorsal. Dorsal is one that you probably have used at some point as well, because have you ever heard of a dorsal fin? I mean, we don't have dorsal fins, but a dorsal fin is basically, oh, how helpful. So a dorsal fin is just like this little fin on the back. Don't ask me why I have this, but the dorsal fin is a little fin on the back, and that's exactly what dorsal means. It means to the back. So if you've ever heard of these terms, if you've ever used these terms, I mean, try to figure out like how you remember it, because these things, like as you see them in class, I mean, if you can link them to something that you know or you're more familiar with, I mean, you'll be able to remember it a lot better. So I've got an example here, and hopefully I would like an answer, but if I said the ear is blank to the nose, what would you say? Which of these two terms is better? The ear is blank to the nose. If you want to type it, if you want to say it, go ahead. I'm gonna believe someone's here. Thank you. Very good. The ear is posterior to the nose. So that's perfect. Thank you very much. So the ear is behind the nose. So the ear is posterior to it, basically. And very good. You could actually use the word dorsal as well, because both of those, posterior and dorsal, are the same. Technically, they're a little different, but we're going to use them the same way. Now, we also have another like pair of terms, which is medial and lateral. But these are a little bit special because you need to compare them to a very, well, an invisible line going right down the middle of the body called the midline. So if this is the midline going right down the middle of the body, depending on whether it's closer or further from the midline, we're going to use one of the two terms, medial or lateral. So medial means towards the midline, like very close to the midline. And if you say the word medial, I think of the word middle. So if it's towards the middle, it's most likely medial. So anything right down the middle of the body, those are generally like very medial. But lateral, on the other hand, that is going to be away from the midline or further to the sides. So lateral, further to the sides, like let's go ahead and take a look at these examples. The nose is medial to the eye. So the nose is right in the middle of the eye, so that's going to be very medial. But then lateral, the shoulder is blank to the chest. The shoulder is further away to the side. That would be lateral. Now, a couple more kind of special ones, proximal and distal. I mean, they're a little special because they're a little more specific, because proximal and distal are used for extremities, used for appendages. So if you look closely, we've got the upper extremity here, basically your arm, forearm, and hand. Depending on whether it's higher up on this extremity or further down on this extremity, we'll use the word proximal or distal. So distal, I like to think of like distant because that's further away. And then proximal basically just means closer. So in this case, let's go over an example. And if I said the elbow is blank to the wrist, what would be the best term to use there? The elbow is blank to the wrist. Very good. So proximal. Proximal is what we would use here because proximal means that it's closer to the body. So the elbow is higher up than the wrist. And then I could do another example, like the wrist is blank to the fingers, and that would be further up as well. So it would be the wrist is proximal to the fingers. Now, lastly, for our directions at least, we've got deep and superficial, which are once again terms that you probably have used in some way before, because if you think of someone that is considered to be superficial, what are they most focused on, I suppose? Stuff on the outside. Like they're usually thinking of stuff that is on the outside of the body, like their looks, their clothes, their equipment, whatever it is. Like, I mean, superficial means towards the surface, basically, towards the outside. But then deep, if something is deep, you think of like a deep hole, it's towards the center, it's further in. So deep and superficial are basically the opposites here, where superficial would be towards the surface, and then deep would be towards the center. Alrighty, so I've got some examples here, and I would like to go through this with you. So let's go through them one by one, and let me know what you think. So if I said the eyebrow is blank to the eye, what would be the best term that we can use here? The eyebrow is blank to the eye. So if you want to, maybe think of like terms that are, I don't know, what term would you use just on your own? Like, I would say the eyebrow is above the eye. And in this case, I can see it in the chat. Superior is actually the best term to use. So the eyebrow is above the eye. So the eyebrow is superior to the eye. Now, what about the knee is blank to the foot? And I'll give you a hint. This is on your lower extremity. So what term do you want to use here? If it's on your lower extremity, your knee is blank to the foot. Proximal, perfect. So the knee is proximal to the foot because it is higher up on the extremity. So just to kind of give you a warning here, I mean, something else that might come to mind would be superior because it is above it, but the better term to use here is proximal. Now for our last example here, we've got the eye is blank to the ear. So what term would you use to describe the eye is blank to the ear? Medial, very good, because it's more towards the midline, but what about in this view? Anterior. So very good. You can actually use terms, I mean, depending on where they are, you can use multiple terms to describe it because the eye is both anterior and medial to the ear. So, I mean, if it's ever on a quiz or an exam or otherwise, like if there's more than one answer, that's perfectly fine. Just as long as it's correct. But so far, so good. I mean, hopefully you kind of get the gist of how to use these terms, what they mean, but there's a little bit more that we need to go over. So let's keep going and talk about body planes. So body planes. If you look closely, body planes are basically cutting the body in different directions. And if you look closely, you've got one that's going across, up and down in different directions. And this is going to show you different things inside the body. And just to give you an example, do you see this like piece of macaroni here? If you cut this piece of macaroni at this spot, at this spot, at this spot, or this spot, you're actually going to see very different types of organizations. Two separate tubes, two tubes that are connected, one long tube, or no tube at all. So, I mean, these cuts will show you very different things depending on where you cut it and the direction that you cut it as well. To start off with, we have a plane or a body plane that we call sagittal. And to be specific, a sagittal plane is a vertical plane that divides into left and right. So sagittal plane, this is a vertical plane, one that goes up and down, but specifically dividing into left and right. So it cuts kind of down the middle to make left and right sides. But there are actually different types of sagittal planes. So if it is going right down the midline, making a completely equal left and right side, those are called mid-sagittal planes, which makes sense because mid-sagittal, midline, like they are going right down the middle. But what if you don't want to look right down the middle? What if you want to look maybe at this part of the brain over here? That's still a sagittal plane, but it's called a parasagittal plane. So parasagittal plane, that's going to be a sagittal plane, but just anywhere except for the midline. Like, let's just say you want to cut through the chest or one of the breasts or the shoulder or the side of the hip. Like, you just want to cut at a different spot than the midline. Now, still a vertical plane, but notice the difference here. If you cut down the middle like this, you'll see something that looks kind of like this. But what if you cut from the side over here? If you cut from the side, you're going to see something very, very different. So cutting from the side basically makes a front and back portion. The name for this plane is called the frontal plane. So frontal plane, otherwise known as the coronal plane, this is going to be making a front and back portion. So you can see how it's very different, although still vertical, very different, like from what you can see. Now, the one horizontal plane that we have here, though, is called the transverse plane. So the transverse plane, you can see it cuts across the body, and this is going to give you a very different view from the others. Like, you can see down into structures rather than like some part of the side of the body. So you can see, I mean, if you cut down the middle, you'd only see like a little bit of the intestines, the pancreas, the vertebra, but cutting here lets you look down into the kidneys, the liver, the spleen, the stomach. Like, all this stuff is now visible due to the way that you cut through the body. So notice, like, let's take a look at our different planes here. If you look at these different planes, I mean, you're going to see very different stuff. I mean, it's still generally the same area, just cut at a different angle, or, well, actually, yeah, different angle. So this one right here would be your frontal plane. This one right here would be your mid-sagittal plane. And then this right here would be your transverse plane. So you can see like the different angles, and they just have a different name, and it'll show you different stuff. So when you look at these images, I mean, we kind of just went over this. This right here would be the frontal plane. This one is the transverse plane, and this one is the mid-sagittal plane. But a question for you is, using anatomical terminology, how would you describe the position of the eyes relative to the brain? So let's try this out. Where are the eyes blank to the brain in this picture? And the one on the left. All right, so looking at this, you can see the brain is up here, but you can see the eyes are underneath it. So in this case, at least what I would describe is that the eyes are inferior to the brain. So since the eyes are below the brain, inferior would be the term that I would use. Now, let's try and think about this one. Now you can see the brain is here and the eyes are here. Where would the eyes be relative to the brain? So if I said that the eyes look like they are in front of, very good. The eyes would be anterior or ventral to the brain. So once again, looking at different perspectives, you can see the relationships a little bit differently. But then lastly, what about this one? Well, it's a little bit of a trick question because you can't see the eyes. So can't see the eyes, can't really describe where they are relative to the brain. So depending on which view you're using, it's going to be a little different. Now, this part is kind of a bit dry, I suppose, or just like very basic. It's not going to have a whole lot of description, but I mean, we just have a lot of terms that we're going to be trying to get familiar with as we start to talk about anatomy. Because what we're talking about here specifically are things called regional terms or regional anatomy. So when we talk about regional anatomy, we're talking about various different parts or different words that describe different parts of the body. Now, some of these might be familiar because you probably have heard of some of them before. But as we'll see, like there are definitely some that you have not. And just to be clear though, some of these ones that you may not have heard of, we actually can use like for describing different parts of the body. So just to give you some examples, looking at the torso here, we have cephalic for the head. We have cervical for the neck, thoracic for the chest. And then we've got some that you may not have been super familiar with, but axillary for the armpit, sternal for like the sternum in the middle of the chest, mammary for the breast, abdominal for the abdomen, pelvic for the pelvis, and then pubic for like the groin region between the thighs at the bottom of the pelvis. So some of these I'm sure you've heard of, but how about the word axillary? So axillary actually means armpit, and believe it or not, you're going to use axillary at least a few times because you have axillary artery, axillary vein, axillary nerve. And if you know where the word axillary is referring to, then you are in good shape. So we're going to try and familiarize ourselves with these terms as we start anatomy so that when it comes up, you'll know where to look. You'll know, you won't have to learn it at that point. You'll know what it means already. So we're going to be starting off by learning some of these regional terms so that we can use them throughout like the semester. So I'm not going to like just say all these out loud, but I'll at least bring up a few because when you say the word brachial, brachial means arm, but specifically upper arm. So between your shoulder and your elbow, this is your brachial region. And then when you say antebrachial, that means after or before the arm. So this is going to be your forearm. Antebrachial is your forearm. Brachial is your arm. And once again, you're going to use these terms because brachial, you use it in brachial artery, brachial vein, brachial plexus, and then a lot of muscles. Maybe you've heard of biceps brachii, triceps brachii, brachialis, coracobrachialis, like brachial is going to tell you where to look. So we're going to try and have a strong start and get some good like foundation here by taking a look at a lot of these structures as we take a look or before we get started. So once again, femoral, maybe you've heard of Pedal. Have you ever heard of pedicure? So tarsal, maybe not. Patellar. Patella is the knee. So a lot of these terms are going to be used throughout the semester. So once again, I'm not going to just list them, but you can see gluteal, butt, vertebral, the back. So if you can, like that would be something that I would try to work on to help with familiarizing yourself with different regions of the body. But just to be clear, it's going to come up. Well, I mean, like it or not. So if you can learn it now, though, it's going to really help you throughout the semester. Like being familiar with that and seeing how like it's going to be applied multiple times is going to be really, really helpful. Now, I know our lecture is kind of running a little long, but let's actually just finish this up by talking about body cavities. So body cavities. These are a little bit interesting in that the body or the cavities in our body are going to be organized a certain way, and you're going to see certain organizations kind of repeatedly. So let's talk about the major cavities, but then also how they're organized as well. So to start off with, you have two major body cavities. If you look closely, all this kind of like large open spaces anteriorly, anterior. This is the anterior or ventral body cavity. So that's going to include your thoracic cavity, your abdominal cavity, your pelvic cavity. These are big open cavities, which usually have like pretty large organs inside of them. But then the dorsal or posterior body cavity, that is going to be where you can find it running up your backbones, your vertebrae. This is where you have your spinal cord, but then also your cranial cavity, which is where your brain is going to be. So to take a look at these, the posterior body cavity, the cranial cavity inside of your skull, this is where your brain is going to sit. So this is part of your dorsal body cavity, but then this is going to connect to your backbones, which if you look closely, has a space running down the middle of it. And if you look at this backbone right here called a vertebra, do you see this large hole? This is going to be connected all along the backbones so that you form this space within the dorsal cavity, which is the vertebral canal. So vertebral canal, this is going to be part of your dorsal body cavity, along with your cranial cavity for your skull or for your brain. Now, talking about the anterior body cavities is where things get a little bit more complex. And this is also where we start to see like the repeated pattern here. So let's just kind of talk about the thoracic cavity first. So looking closely, in the anterior body cavity, you have the pleural cavity, or sorry, first of all, the thoracic cavity. So this area right here, kind of within the rib cage, you have a couple of different regions. The pleural cavity is going to be where you have your lungs sitting. So these two on the sides are your pleural cavities. But then this area right behind, or right between them, right behind the sternum, we have a term for that, which is called mediastinum. So mediastinum, if you look closely, what shape is this? What do you think is going to fit right in here? This is where your heart sits. So right between your lungs. This is where your heart is going to be, and connected to it, many major blood vessels. So the thoracic cavity has the mediastinum as well as the pleural cavity. And then also in the anterior body cavity, you have the abdominopelvic cavity, which is divided into abdominal and pelvic cavity. So abdominal cavity, like that's going to be everything, or that's going to start right below the rib cage going downward. That's going to be where you have your digestive system. So this right here is your abdominal cavity. This is where you'll have your stomach, your intestines, your liver. But then going all the way down into the pelvic region within your hips, this is where you have the pelvic cavity, where depending on your sex, it will have various reproductive organs, but also the bladder, the urethra, and the end of the digestive system. Now, as promised, let's talk about this organization a bit, because when you look at especially those abdominal or those anterior cavities, you're going to see a repeated pattern. So what we're going to see is that you have this thing called a serous membrane lining this cavity. So this is going to take a little bit of wrapping your head around it, but take a look at this like balloon here. So let's just imagine like this balloon is representing your serous membranes. And then this fist right here, your hand, is representing your organs, or rather your visceral organs. Now, if you put your hand into the middle of this balloon, like if you try to just push your hand into that balloon, you actually are forming two layers and a space in between them. So if you look closely, do you see that there's a layer that's connecting, or rather directly surrounding your hand, surrounding your organ? This is called the visceral layer. And then if you look closely, there's an outer layer that is not touching the hand. This, in this case, is along the outer wall of the cavity, called the parietal layer. So parietal layer here, that is going to be the outer layer. Visceral layer here is going to be the inner layer. And then, just to be clear, like it's not just the layers, but you have that space, which is really important too, which in this case is called the serous cavity. And typically, it's going to have some sort of fluid, which generically is going to be called the serous fluid. So serous cavity, serous fluid inside of it, and then touching the organ is visceral layer. Along the outside is the parietal layer. So I know this is a little bit weird, but if you have questions about it, let me know. But you're going to see this multiple times. So let's go ahead and take a look at our first example with pericardium. So once again, what does the word cardio mean? Cardio means heart. And then peri, when we see the word peri, means around. So around the heart is the pericardium. But once again, take a look at these layers that are surrounding the heart. So you have to kind of look closely on this one, but there's actually two layers and a space in between. So look at this one a little bit, which is a little bit bigger. This region right here, it's touching the heart. It's touching the organ. So this is called visceral pericardium. So visceral pericardium is the one touching the heart. And then in the mediastinal cavity, the one that's along the outside, this is called parietal pericardium. So do you see kind of like how it's the same, just a little more specific? Parietal pericardium is the outer layer. Visceral pericardium is the inner layer. But then you also have the space, which is the pericardial space, which has pericardial fluid inside of it. So basically, this is helping to cover the heart, but also hug the kind of like cavity as well. So something I probably should explain though is why. Like we have these layers, that's great. You can kind of understand the words, that's great too. But a good thing to think about is why? Like, I don't know, this seems like it's making it just more complicated, right? But what you have here is basically an anchoring layer, both along the wall, as well as like the organ itself. Those are going to be helping to keep it in place. It's going to be covering it and protecting it. But then also inside of this pericardial cavity, like with that pericardial fluid, it's basically helping to lubricate it really, or protect it even further. So just to kind of give you an example, what is your heart doing? Like right now, like all the time. It's contracting, it's pumping. And as it does that, it is moving, it is rubbing against things. It is, I mean, potentially damaging itself. Like, I mean, if you rub your hands together and I mean, right now, great, no problem. But if you do this for 70 years, your hands are going to get kind of messed up. And that's what your heart's doing. Like, your heart is just pumping all the time, rubbing against like other organs, other tissues to help with protecting it. You have the layers, but also this lubrication helps to make sure that it doesn't cause too much friction either. So, I mean, this is something that you'll see surrounding many of your different organs. So, I mean, let's just go ahead and take a look at our next one, which is called the pleura. So, the pleura, do you remember what the pleural cavity is? Maybe not yet, but it's basically where the lungs are, directly to the sides of the mediastinum. So, these are your lungs, and this is where you're going to find the pleura or the pleural like covering. So, like last time though, you have an outer layer. What's the outer layer called? Parietal pleura. And then inner layer, what's the inner layer called? Visceral pleura. And then just like before, you have a pleural space and a pleural fluid. Because once again, just like your heart, what are your lungs doing? Like every time you breathe in and breathe out, they're rubbing against that rib cage. So protecting it, lubricating it, helps to prevent friction and damage. Now, lastly, for our serous membrane that we'll talk about, but the most unique out of the three is peritoneum. So peritoneum is the covering surrounding the digestive organs. And once again, you have parietal peritoneum along the wall, visceral peritoneum on the organs, peritoneal space, peritoneal fluid, but take a look here and you can see that it's a little bit different. Like, I mean, you have these double layers here, which are just kind of extensions, allowing the organs to hang a little bit further. But oh, don't worry, we'll talk about that later. But for now, you can see that you have a parietal, a visceral, and a space. So in this case, it's parietal peritoneum, visceral peritoneum, and then peritoneal space. So with that said, that's about it for today's lecture. So I know it's kind of a bit with like the intro to the course as well, but this is kind of like an overview of like how we're going to organize stuff in anatomy. So if you can, I would definitely start kind of like working on learning those regional terms, those directional terms, and then maybe check out that structuralist to see what you want to work on for lab. But I know so we don't really have like, you know, a lab today because unfortunately not in the lab room, but starting on Wednesday, we will have activities which will go along with the stuff that we're learning. But remember as well, like take a look at the study guide, like the PAL questions. This is just like an example of what was on that study guide. No general functions of and examples of organ systems. Can you think of any organs that belong to more than one system and so on? Like that was actually what I was showing you earlier in the PAL questions. So this is kind of like what you want to be able to go over to make sure that you have a good idea of like what was going on in the lecture. So that is about it for today. But I do have like a kind of like small exercise that I would like you to kind of think about to finish up today, because starting when we're in class, we will have some activities. And to give you an idea, like I have some different types of exercises which you'll be able to do like together in groups as well as using the models. But maybe, or what I'd like to kind of think about is, what do you think you're going to learn in anatomy? Or rather, what do you want to learn about in anatomy? And that's just something that I want to like talk about with everyone, or have you guys talk about while in class on Wednesday. So try to think about that just as some food for thought. But with that said, that's about it for today's class. Like, unfortunately, no lab, but if anyone has any questions about anything, please go ahead and feel free to stay. but that's about it for tonight. So a little bit early. Don't complain too much, but I'll see you all on Wednesday. Bye.